So, I was talking about mechanical exfoliation of the skin by MDA and using chemicals through peels, chemical peels. Now, peels are of three types depending upon the depth on which they work. That is superficial peels, medium peels, and deep peels. Superficial peels usually are alpha hydroxy acids, medium peels are beta hydroxy acids, and deep peels are phenol peels. Peels can be used in areas like face, hands, back, legs, wherever you want resurfacing. It is also used to remove pigmentation like freckles, melasma, and to improve the skin tone, reducing fine lines and wrinkles. Now, peel removes several layers of skin which is damaged by sun, leaving fresh skin which has a more even surface and color. It stimulates new collagen to be formed by improving skin texture. Light peels are commonly performed using alpha hydroxy acids. These alpha hydroxy acids are found in fruits and other foods. Light peels are used to treat dry skin or acne prone skin, liver or sunspots, very minimal fine lines or fine wrinkles. It also decreases pore size by improving skin texture. Light peels are performed in a series of 6 peels, each peel 3 weeks apart or 1 month apart. After applying the peel, the skin gets a red glow which lasts for a few days or so. Medium peels, mostly these are trichloric acid peels or TCA peels. This is not performed very frequently. They have the same benefits as light peels, but they also remove larger wrinkles and deeper pigmentations. These have a deeper penetration, so those are deeper into the skin. These are removed by medium peels. A drawback of this medium peel is that it makes the face look severely sunburned for a week or so. The person may have to stay in for a week or so to recover from this procedure. Sun exposure is contraindicated, and also you should not peel it with your hands if you see the peeling occurring. Deep peels are usually performed with phenolic acid to get rid of larger wrinkles. It has a very dramatic results like a facelift. The recovery period is very large, that is 1 to 3 months. In medium peels, it can be for about 15 to 20 days. At this period, we do not perform any type of peel. Now, the concentration of peels is determined as in the acid alone, but the pH value is also important. Now, superficial peels which we get is usually from 20% to 70%, which might be glycolic acid peel, salicylic peel, mandelic peel, or lactic peel. As we know, oily skin needs salicylic, glycolic, and mandelic acid peels. A dry skin need gentle peels like lactic acid, and sometimes pigmented skin we can use glycolic and phytic acids. To start with, it is always safer to use from low concentration peels, 15-20% peels. Once you start getting confidence and a good hand at it and understanding the end results and points, you can start going for a 20 to 35%, even up to 50%. These peels remove the dead cells which are piled up on the epidermis. It stimulates the collagen, increases the skin structure, and tightens the pores. Usually the lighter peels are used after every 6 weeks. These smooth and rough skin texture improves sun damaged skin, aids in control of acne, can be also used to brighten the skin. You use the skin percentage also along to the sensitivity of the skin. 4 to 8 sessions are usually advised with AHA peels. TCA peels is done once in 6 months, and phenolic cream peels once in a year or 3 years. Who should not have a peel? Now there are candidate selection is also important. Clients using Accutane within last 6 months, because the skin is sensitive, it is more prone to frosting. With active herpes simplex or cold sores, who are having facial warts, with keloids, history of sun allergies, and who also have had a history of bad reaction to a peel. Recent sun exposure in last 2-3 days, or radiation for cancer, surgery or cryosurgery within 1 month. Cryosurgery within 1 month to that area to be peeled. So these are relative contraindications. What preparation should you do before the peel? Now 2 weeks before the peel, you see that they have stopped all steroid creams, retino creams, and also exfoliating sponges. All types of hair removal procedures should also be stopped before the peeling day. Take a written consent, explain the procedure and post-op care and home care to the patient. When the patient comes, clean it thoroughly with a cleanser. Peel should not be applied at the corner of nose and the mouth. So these areas are protected with petroleum jelly. And then you apply a thin layer of the peel starting from your forehead with a brush or a earbud. In cases of in areas of high pigmentation, you apply a second coat. So cover the full face or the target area with the peel by a soft brush or a peel brush or a earbud. You keep the peel for about 4 to 5 minutes till the tingling sensation is reduced, or till the time you see redness or frosting. If you see redness and frosting, you can immediately neutralize the peel by using plain water or a neutralizer. Neutralizer gives more burning sensation, so I prefer using cold water to neutralize the peel. After that is done, you can apply a soothing gel on the face or give a face pack to cool the area which is having a burning sensation. Apply sunscreen to the patient and then ask him to leave the clinic. What do you do after the peel then? You recommend after the peel. The patient's skin might appear a bit red, so that is normal, which might go in within 24 hours. The patient is advised to use soothing gels at night. He is advised to use UV protecting sunscreen. with an SPF factor of 35 and above. Or she may start wearing makeup after 24 hours provided there is no crusting or tenderness to the skin, or best wait for 72 hours. To avoid scarring in the areas of peel, they should not pick or scrape or scratch the skin or use any abrasive of exfoliative sponges. The tender skin is not yet mature, so it might scar or leave hyperpigmentation. Do not use retinoe during the peel session or post-op peel for 1 or 2 weeks. They can use hydrocortisone gel to reduce the reaction. They should not be exposed to sunlight or any irritants. What can be the possible side effects after a peel? There can be brown discoloration of the skin in case you peel off or pick up the skin during the peeling. This is usually reversible and very rarely permanent. This occurs if there is peeling, picking up the skin, and sun exposure. If there is skin infection or cold sores, a peel can tend to flare that. So you can prescribe a cyclovir tablets. Peels will cause redness of the skin. Mild peels usually don't give much of reaction to the skin, but medium and deeper peels might give some complications or reactions. So you have to go through the medical history properly. So avoid patients with facial warts, with having a reaction to peel or dermabrasion, who has past herpes simplex or cold sores. History of same as what we did in superficial peels, sunburns, cryosurgeries.